In 2000, we made a paradigm shift in bone science, osteoimmunology. What is the relation between immune system and bone? Immune system controls everything in the bone, the formation, the resorption, the homeostasis. On the other side, bone system has a huge influence on immune cells, and it's the primary lymphoid organ. Where do we meet the bone marrow? Into the bone. And this is why we consider today that we have only one system. It's the osteoimmune system.
How does the immune system fails? Only when inflammation persists, leading to an immune system failures. And we know what will happen clinically when the immune system fails. You understand why the keyword is inflammation.
Even if you are the best surgeon, using the best materials and technique, you know that in the end, it's the patient who decides the final outcome. How to detect patient with risk of complication? How to meet patient that will show incomplete results? This is the question. And then we need to go back to the immune system, which is in charge of the global health. If we can assess the level of inflammation, we will be able to assess the immune system. How to do that? With the inflammatory index. Inflammatory index were introduced by Bohu in 2014. The systemic immune inflammation index and the systemic immune response index. How to calculate? Simply multiplying neutrophil by platelets and split by lymphocytes. Siri multiplying neutrophils with monocytes and split with lymphocytes. So what happens today? We are meeting a huge excitement in science. 850 publications last year, almost 1,000 in 9 months. It means that we are getting more than 100 publications every month. What are the information given by the index?
First, the mortality is linked to the inflammatory level. You want to know if you're going to have a short or a long life? Calculate your index. If you have a higher index, you may die younger. Second information is that patient survival after cancer is related to the index value. In this publication, 5 years after surgery, the survival depends on the index of the patient. It is amazing. We can now have a pre-op prognosis. The same for neuroblastoma. We can know at the time of the consult, depending on the patient index, if they're going to survive or not.
Do you want to know if you will end your life with a Parkinson's disease? Calculate your index, and maybe you will have a bad information. You have a patient with diabetic starting a foot ulcer. We can predict which patient will get amputation. A lady with osteoporosis, we can predict if she has more risk of fracture in the hip. It will depend on the index level.
To resume, when we encounter patients with high index, it indicates a deficient immune system. It is a negative factor for their recovery and their survival after disease or surgeries. They are more likely to face complications. But can we say the same in surgery? In our educational courses, we always insist on the quality of the surgery. Today, we can show how it matters. Robotic surgery induces much less inflammation than classic surgery, even laparoscopic.
Total knee arthroplasty. Can we predict the infection post-op? In this retrospective study, they show that people with high index are getting infection. This is completely unbelievable. we can detect the patient that will get infection. The platelets, when they are over 300, the patient is getting infection. It means that for us now, we consider that the platelet level or the platelet count is a warning signal, over 300. Let's go to oral surgery. This is a lady, 60 years for bone augmentation. We take a look at the CBC, but in May we did not start to calculate yet the index. And we didn't see this information. This information means the patient has a high level of inflammation, but we didn't know. And we did the surgery, and it failed. In June, we started to calculate retrospectively, and we saw that the index was high. 3 months later, let's go to make a control. How are the index less than 60%? What does it mean? We use it, an antioxidation treatment, an immune supplementation in order to reduce the level of inflammation.
So what we do now? At the pre-op consult, in addition to cholesterol and vitamin D, we calculate the index thanks to the CBC. And if you encounter a patient like this with really high index, please, my friend, postpone the surgery. Don't touch them without immune preparation. Otherwise, you may fear complication.
So now, you understand it's possible to know the inflammatory level at the time of the consultation, at the clinic. How to do that? We propose to you the LINKOR Signature. What do we do with the LINKOR? Patient is coming at the consultation, immediately we take 3 drops. And we put these 3 drops in a small vial and then into the LINKOR. And the LINKOR in 10 minutes will give you all the information you need. Glucose, cholesterol, vitamin D, all the index.
My friend, we are at the dawn of an amazing era. We can now, at the clinic, at the time of the first consultation, assess the patient inflammatory index, vitamin D, cholesterol and glucose. We can better predict which patient will get complication and failure, and so better prepare them with an immune treatment, and also detect all the patients that have more risk to develop periodontitis. Thank you.